The World Health Organization says that studies show that cases caused by the COVID-19 Omicron variant appear to be less severe, with hospitalization rates lower than the Delta variant. And there are also news that says that Omicron is affecting children more than any other age group. Well, joining us to talk more about this in the studio is Dr. Patricia Akinto, a consultant pediatrician, Pediatric Infectious Diseases Unit, the Lagos University Teaching Hospital, Luth. Many thanks for joining us on the program.
Thank you. Good evening.
Good evening. But I'd first like to begin with your thoughts about the pandemic since it started, and especially where we are now. And this is also, as we just saw, over 700 cases recorded last night in Nigeria.
The pandemic has actually never left, and we are now out of the woods, and it's coming back stronger than it was because we were seeing rising cases in recent times. So we are in the fourth wave.
So looking at Omicron, do you think it complicates things?
It's the variant of COVID-19. We have various variants. The problem about Omicron is that it spreads very fast, and the symptoms are not typical like the other variants, so it's likely to be missed, especially in children where you see them having stuffy nose, runny nose, sneezing, they have a sore throat, and they have a headache. So we'll probably think it's a common cold. That's where the problem lies.
So we saw that countries, take South Africa, for example, recently some children had gone to hospital for various other reasons. One was malaria, another jaundice, a third even a broken bone, and then they all did a COVID test and they were positive. Are we seeing any of that here? And if you look at the data since the pandemic began, in terms of the children in Nigeria, is there like an increase in terms of those coming down with COVID? And do we know anyone that has perhaps gotten Omicron variant or recorded any?
For children in Nigeria, they've had COVID. But you know those centers, those countries you're talking about, they do a lot of massive testing. We are not even testing enough. So we have children with COVID. But for you to say it's Omicron, you have to do some sequencing and type the organism, which we haven't done. And I suspect we may already have Omicron in Nigeria, even amongst children, but just that we haven't really typed them among children.
What are the expectations? Take, for example, Lagos State in terms of testing.
We need to increase our testing. Everybody needs to, if you have a symptom, go and test, and that's the only way we'll pick those who are infected. The children do very well with viral infections. The COVID is not a major problem for them, but then it's a problem for the adults who move around the children. So children are playing, they have COVID, they play around, and the adult now falls sick. So if it gets to the children, it will get to the adults.
Apart from that, we're also seeing the federal government say, okay, now time for booster shots. It's happening in other countries. We're seeing breaking news that booster shots give you better chances against Omicron. The Africa CDC is saying just the vulnerable should take the booster shots because we don't have enough for everyone on the continent. But for children, we haven't started talking about vaccinating children in Nigeria. Should that be something that should be on the table now?
Definitely should be. We should think about vaccinating children. But the truth is, we've not vaccinated the adults enough. Even those most of those that are exposed or are working in high-risk areas, they haven't been vaccinated. The government is trying to give us a booster dose. So, but we should think about vaccinating children, because once you keep a group of persons that are vulnerable, the children are, and get infected, they keep spreading these things to other people. So we should think about children. But the issue is that the vaccine is not even enough globally. So we need to prioritize who you give what to at a particular time. Because for them, children, why we are not giving children now so much is because it's not a major issue for them. It's more for the adults.
So moving forward, and this is also as we try to stem this fourth wave, what's your advice?
Everyone should be at alert. We are not out of the woods. So all our protective measures we should keep on. People don't wear face masks anymore. They just go about as if it doesn't exist. It does. Even children, encourage them to wear their face mask when they are in school. And because if you don't go out as an adult, your child goes to school, brings it home to you, you get it. And that's the best way we can do. Let's just keep doing what we were doing before, and we'll be good.
We'd like to thank you. We appreciate your time on the program. Dr. Patricia Akinto, consultant pediatrician and pediatric infectious disease unit with Luth. Thank you for joining us on the program.
Thank you for having me.